Hello, my name is Austin Anderson, and I am a student of Dr. Levine for the Levine Scholar Program. And today, for my project, I want to talk to you about cancer during pregnancy and just what to expect, some initial diagnostic tests, and basically where to begin. So, for this project, I interviewed a doctor by the name of Dr. Tarantolo, and his specialty is oncology, but he also specializes in myelomas, lymphomas, and leukemias. And he's located at Nebraska Cancer Specialists, and this is just some information on him. Throughout this presentation, I'm going to be including information that I got from our interview and just his opinions on some of these topics. So right off the bat here, we can see some common pregnancy symptoms. So initially, when a woman becomes pregnant, there's a lot of changes that happen. There's bloating, there's headaches, there's rectal bleeding from hemorrhoids, there's breast enlargement, many changes in the skin, and these are all completely normal signs of pregnancy. But if you look at this next slide here, so we have common cancer symptoms. So a lot of these are the same as common initial pregnancy signs and symptoms. So headaches could be a neurologic cancer, rectal bleeding could be colon cancer, breast enlargement, the nipple tenderness, that could all be indications of potential breast cancer or something with the duct. And then changes in the skin, any types of melanomas. So it's very difficult to diagnose cancer during pregnancy just because of all the changes that are expected. So let's transition here to detection. So you're suspicious that you may have something that's out of the normal. You've noticed a new lump. So, like I had mentioned before, it's difficult to diagnose while a woman is pregnant, but it's generally found because somebody finds a new lump or has a new pain or notices some other body change. But unfortunately, once they feel these lumps or notice the pain, that means that the potential tumor is often very large when it is detected. So, another way cancer can be detected is just through the routine prenatal visits. And so during these prenatal visits, the cervix gets examined quite a bit. And so that's kind of how doctors can detect cervical cancer just by noticing any changes. Same with the breast tissue, like it's very easy to notice changes when you're going to your prenatal visits and your wellness checks just to make sure that nothing is out of the ordinary. And then with ultrasounds too, that's generally how they see like if there's any fibroids or anything abnormal with the uterus, and then surrounding tissue that shows up in the ultrasound. And then finally here, open-ended communication. So just discussing with your team, with your family, that open-ended conversation with your obstetrician, keeping them in the loop if any changes that you notice. Maybe a family member notices something on your back or like the back of your neck that you may not have seen before, so just keeping up to date with all the changes. So some risk factors here. So these are the three main cancers I'm going to go over in a little bit. So for breast cancer, we have the older age at the birth of the first child. So as a woman gets older, more complications arise in terms of hormones. And then adding pregnancy to that, that just creates more complications that can arise for the baby and also for the mom. So something that Dr. Tarantolo mentioned was Ashkenazi Jewish descent. So that is a hereditary trait to be at higher risk for developing breast cancer. It's something in the genes of this cultural group. And then also hormonal manipulation. So with a lot of infertility treatments, they're going to be introducing a lot of estrogen and female hormones to increase ovulation and to stimulate more egg production. And so that can also have a negative effect, causing mutations of certain tissues, which can lead to the growth of cancer cells, essentially. And so cervical cancer, most of the time, this is HPV origin, and how that comes about is just HPV infection, and that is from the lack of a vaccine. So generally, they get HPV vaccines in middle school, from what I remember, and early high school. And then most of the time, that's also family history as well. So it kind of increases that threshold of getting cervical cancer. And then thyroid cancer here at the bottom, it's just a history of exposure to radiation and then also an iodine deficiency, which is kind of the leading causes of this cancer. So with breast cancer here, just a quick fact, we have 1 in 3,000 pregnant women, and they're generally between 32 and 38 years old. And so like I mentioned before, the older they are when they begin having children, the more complications that arise. And so how they diagnose breast cancer is going to be your mammograms, your chest x-rays, and then to see if it has spread, they're going to do bone scans, ultrasounds of the liver, they're going to MRI the brain, just to see if it is going throughout the body. And then they'll also do like biopsies just to see if it's affecting any of the lymph ducts. So for treatment of breast cancer, the gold standard basically is surgery. And so they're going to do a sentinel node sampling, which is basically where all the ducts meet. And that's like the main duct that's going to be draining the cancer cell. So they're going to sample that first. And then generally they go to a lumpectomy, which keeps the breast tissue intact, especially if the woman's pregnant and she plans on breastfeeding. She wants the milk ducts. She wants all of the tissue that needs to be there for the baby. And then finally, we have mastectomy, which is just total removal of the breast tissue and some of the lymph ducts up in the arm towards the tail of Spence. And then we also have chemotherapy, which is generally saved for after the first trimester when the baby is not developing its neural tube and it's not um, developing its essential organs, basically. Then we have endocrine therapy. This is kind of a prophylactic treatment for patients who are at higher risk, so patients of the Ashkenazi Jewish culture and also who carry the BRCA gene from a mom or a grandma. This drug here, it's a selective estrogen receptor modifier, so it's basically going to help reduce the risk of certain cells in the tissue from becoming cancerous. And then we have targeted therapy, which is basically just going to block certain proteins, which is going to help stop the growth of the cancer tumor, which I found interesting. And so next here we have thyroid cancer. This is about 14 in 100,000 pregnant women. And then so even without being pregnant, women are more affected by thyroid issues just because they are generally autoimmune, and with the higher levels of estrogen, that puts women at a higher risk for having these complications. And so in pregnancy, the thyroid is going to increase by 30%. And so that rapid increase is going to fluctuate in the body. It's going to kind of throw things out of whack. And then so down here, I just included some diagnostic criteria. Basically what they're going to do if there's any suspicion of like nodules or you feel something in the thyroid, they're going to treat them as if they're malignant. Not necessarily say they're malignant, but they're going to like quickly get them tested, quickly take a biopsy. And that's what I have here, the fine needle aspiration, which is basically a biopsy. And they're going to make sure nothing is wrong. And so finally, cervical cancer. This is generally found early and it is confined to the cervix. For the most part, this is a slower growing cancer. But with this cancer, it's important to kind of know your future plans because this has large effects on the mom. Because if the mom wants to remain fertile and she wants to have babies in the future, treatment can definitely affect the outcome. Generally, so with cervical cancer here, the treatment, what they're going to do is they're actually going to try and postpone treatment depending on how severe it is, because as they start doing biopsies with the cervix and as they start taking tissue, that puts the baby at risk for getting an infection, and they need to maintain basically the only thing that is keeping the uterus sterile. And unfortunately, if it is a fast-growing cancer in the cervix, it's going to kind of require the mom to not be pregnant anymore, and generally a hysterectomy is imminent with chemotherapy and then in addition to radiation. And also with the slow growing cancer, they're going to do a C-section and try and get the baby out around 37 weeks just to not wait any longer and try and get the cancer treatment started as soon as possible. And then I have included here just some other types of cancers. So Dr. Tarantolo mentions some of his patients that he has been seeing have melanoma and leukemia. And so he's been seeing like a slow rise in these two cases. He says, I believe melanoma is becoming a more common type of cancer for pregnant women. So you are suspicious that you have cancer. The doctors want to start doing tests. So some of these tests that they're going to do are you have x-rays, you have the magnetic resonance imaging, which is just MRI, you have CT scans, ultrasounds. There's also mammograms that I didn't include in here but talked about prior. So most of these tests are safe for the mother and the baby, but overexposure to that radiation is actually going to harm the fetus. So they generally save like CT scans and x-rays for like a last resort. But there are measures they take to ensure safety of the baby. So there's shields that the mother wears around her abdomen, and then there's also vests and lead vests that they put on in addition to the shields to kind of help limit how much radiation is penetrating the skin and going into where the baby is. And so some treatments during pregnancy, essentially the main priority is safety of the fetus, but safety of the mom is also important because without the mom, there is no fetus. And so some surgeries that I have mentioned in the past, so mastectomy, we have the cervix removal, and then just some other gynecologic surgeries to help limit the spread of the specific cancer. And so as I mentioned before, so chemotherapy is actually safe, but only in the second and the third trimester. And so some of these drugs that I've included here, the 4 bolded ones, are the safe chemotherapeutic drugs that do not affect the fetus. So the placenta is actually going to stop these drugs from crossing over into the baby's blood, which I thought was interesting. And so down here I have radiation, and then these are all just types of radiation that are used on pregnant women. And then, so if you have any additional questions, I have included on here a QR code to scan just with your smartphone camera. And so this is just basically a summary of everything that I went over, just condensed into a brochure. So feel free to scan this. There's some information for you. And thank you for listening.